So if you're planning to begin anatomy, I really want to say that upper limb, lower limb, very important, abdomen, wala that CT, wala things, how do you, in radiograph, how do you identify, how do you give that number, very important, hydatid cyst also, that you can, they can integrate with the microbiology, kind of coccus and all those things, who is a definite host, they'll be going, they can ask actually, as well as CT of heart is very important. And about this upper limb, I have already told. So, what is about that Earth's paralysis and clump case paralysis and all those things they can definitely ask. And what all that's what that's cervical CAT on which one is affected, just do learn it. Lower limb, I have already explained that saphenous vein wala thing. It's all those things very important. So, please don't miss it. Histo one images for sure. You can just look at the pictures and how to identify. Like if they give a picture of pancreas, you want to identify it as pancreas. So germ layer thing, that is medullary thyroid carcinoma, that MEN2, that is very important because they'll be going to integrate with surgery and us. That part very important. That's neural crust cells and all those things. And about abdomen, you can expect a question. So abdomen means very important. That is umbilicals, which level, like L4 thing. Very, very important. That transpyloric level, L1, wala, subcostal plane, and all those things. So very important. And you want to see what all structures is there in this transpyloric. That's very important. That dermatome, wala, very important. Please never miss it. And other thing, the important thing is pharyngeal arc derivatives. That is very important, like facial nerve, which is a nerve like from where it is contributing, like mandibular, like fifth, and what all things, the muscles it is applying. Very, very important. The tensor tympani tensor veli palatine muscle, that is fifth from the arch, that is arch 1, that is fifth, there's a mandibular nerve, as well as very, very important, that is, and all those facial nerve, facial muscles and all, very important, that stylopharyngeus. And there is a big table in your textbook itself. Please do learn it. That's very, very important. Voila, you get to know, na? There's mandibular nerve, 7 nerve, facial nerve, from which arch, second arch, like that. Very important. As well as that pharyngeal pouch derivative, like second from the tonsils. What about the thymus? Very, very important. What happens in DiGeorge syndrome, that catch-22, very, very important. Please don't miss it. That one, first arch, second arch, third arch, very important. So what happens in the branchial cyst, voila, that's very important. They integrate with surgery and ask. And about aortic arch derivative, that is very, very important. So that is ductus arteriosus, from where, like this left sixth arch, na, that wala, very important. Every time they repeatedly ask that question. And also about the genital derivative, very, very important, that you will be learning in OBG, as well as that is duct of Gartner's, that males, that's Wolffian thing. So please learn it. So what happened to this paramesonephric ducts, what it will be giving rise to, and all those things. Please learn. There is a standard box in your textbook as well as in the OBG book also. Please learn it. And also very important, yes, very important is this upper limb, voila, the muscles and muscles, that long thoracic, what happens in beginning of scapula, which muscle, which nerves, very important. How you elicit that tibial, medial malleolus, that all those things. Tibial, you want to know about medial malleolus, that artery, all those things. Dorsalis pedis artery, valla, please learn, as well as cleft lip. So what is happening in the failure of fusion of what, like medial, nasal and maxillary process, that is going to be very important. And about that this thing, Trendelenburg sign. So how is a normal person, how is abnormal, so which gluteal nerve, that voila, very important, which nerve is affected, whether it is superior gluteal nerve, that voila, you will be knowing. A person will be standing and there is one side slack. Please learn, it's very important. And also about another thing, in 2023 they have given an x-ray of the abdomen, and they have asked some questions like to identify, as well as they have asked in CT image of heart, also were asked to identify. So don't miss CT image of this heart. Very, very important. See what is piriformis syndrome, which nerve is affected, sciatic nerve, and how to identify this, that like median nerve. There is a cord nerve like median nerve, how to identify ulnar nerve, radial nerve in this upper limb. Just learn to identify the nerves in that region. That is going to be very, very important. Don't forget that CT scan of heart. You will get in most of the radiology things. And what happened, what is this portal triad, and what is about Mickey Mouse sign, very, very important. And about the liver things, how they like, that is 1 2 3, that this thing, that division there is, that right and the left there is this thing 4A 4B. Please learn that. They will ask the CT image of this liver abdomen wala, I just already explained. Please learn how it is, that numbering part. And also very important, always it will be like this, you will be knowing the snuff box, anatomical snuff box, all this roof, floor, contents, very, very important. Yes, that is very important. Souls, yeah, once 2 years they have asked. If you get time, you can just read and go. As well as medial plantar nerve, and already I have explained to you all guys that this thing, yeah, spring ligament is very important. Spring ligament, there are certain ligaments in the foot, spring, triangular ligament, and all those things. Please again read it. And one of the important question, 2023 as well as 22, their favorite, but we didn't see a question in 2024, but we can definitely hope for a question. They can definitely ask, we can just imagine. So that is male perineum, that deep perineal pouch wala thing. They have asked like what happens. A clinical based question was there. That deep transverse, that membranous urethra, and all those things, corpus, that is bulbourethral gland, what thing that you will be get to know. That in surgery also, when there is a manhole injury to the perineum, what happens, just connect it, just read it and go. How is that? Colles fascia wala thing, you'll be knowing that. Don't miss it. Okay. So these are the must important topic when you analyze from the 2019 onwards. You can see at least study. Yes, of course, you can definitely get through this anatomy. Don't waste so much time behind anatomy, because we have got so many other subjects also. Please never lose your hope. Yeah, time is there. Till time is there. I always want to say that stay away from people with negative intention, and always think and always look into yourself. Yes, of course, difficult roads often lead to beautiful destination. Yes, your time also will definitely come. God have already written a very beautiful thing for you. Just go ahead. So, and it's me, Dr. Amda here. Thank you guys for listening. Thank you all.